कल शाम को एक बड़ा CME, उसको हम कंटिन्यूस मेडिकल एजुकेशन प्रोग्राम बताते हैं, वो हमने पारस हॉस्पिटल की वसासत से मुनक्कद किया। और इसमें प्राइमरली हमने वो चीज़ें डिस्कस की जो कार्डियोलॉजी और कार्डियक सर्जरी में नहीं है। नई का मतलब ये है कि वो पेशेंट्स जो बहुत ज़्यादा बुरी हालत में होते हैं और कोई इंटरवेंशन करना हो या कोई सर्जरी करनी हो कार्डियक, उनका रिजल्ट कैसे बेहतर से बेहतर बना देते हैं। तो दो लेक्चर्स थे, एक डॉक्टर फयाज अहमद शाwl साहब हैं जो अमेरिका से आए हैं, टेकोमा पार्क वाशिंगटन एडवोकेट्स हॉस्पिटल के डायरेक्टर हैं कार्डियोथोरेसिक लैब के। उनने एक पहला लेक्चर दिया, उसके बाद दूसरा लेक्चर दिया डॉक्टर हरिंदर के बाली ने, जो पारस हॉस्पिटल पंचकुला में चीफ हैं, और उनने भी उस नई तकनीक का डिस्कस किया जिससे पेशेंट बुरी हालत में होके भी इंटरवेंशन कर सकते हैं और वो बच सकते हैं। शाह साहब के बारे में मैं इतना बताना चाहता हूं कि इनने हमारे स्किम्स में हमारे कैथ लैब डेवलपमेंट में बहुत बड़ा रोल अदा किया है। 2005 से लेके मुझे लगता है जब मैं भी वहाँ था, तकरीबन हर साल आते थे और जो मुश्किल से मुश्किल कोई भी इंटरवेंशन था इन्हें हमें वहाँ पे करके दिखाया और हमें सिखाया। और हम इनके बहुत शुक्रगुजार हैं कि जो आज हम यहाँ कार्डियोलॉजिस्ट कार्डियक सर्जन काम कर रहे हैं, तो स्किम्स से पढ़ चुके हैं, उसके लिए हम बहुत शुक्रगुजार हैं।
Oh, thank you, Dr. Rashid. What he said was that we were able to discuss new technologies and new facilities like PARS, where people can have intervention without surgery. I've been here for the last 2 days, seeing patients and looking to the infrastructure. I think Kashmiris should be very happy that they have a good hospital here with all the facilities like we have in America, and they have excellent cardiologists, excellent skills. By that, people don't have to go outside J&K, they can come here and have all the facilities, particularly now in the heart disease. Heart disease is the #1 killer in the world, and they have all the facilities here. I think as a press, you need to make people aware symptoms of heart attack, because a lot of people are dying here because of heart attack. The key thing is the early recognition of symptoms and coming to quickly and have the treatment, or we can open these blocked arteries which cause a heart attack. So I think that's all I have to say, is that I'm very pleased I've been here for 2 days, that we have a great facility here with great skilled, great experienced doctors here, which can do a lot of things, or as we do in America, they have all the facilities here. So if you have any questions, I'll be more than happy to answer.
Doctor, you had been here in Kashmir, I think, some 7 years ago?
Yes.
You were actually planning to set up a hospital here, but the then government refused to.
Yes, you're right. It was about 10 years ago. I had this dream of developing a hospital where patients who can afford to have it done. Then I don't want to go to the politics.
So how much the medical, as far as medical facilities are concerned, how much change you have noticed? Then and now.
Oh, tremendous change. I think the facilities are phenomenal now. I mean, I've been here for 2 days at PARS, and I'm very impressed. Much better and more facilities than when I was here 5-10 years ago.
Many young persons have been died, with the heart attacks.
Yeah.
We have seen past many years. What is the main reason you have find that many young people have been died with this disease?
I think the #1 is people who smoking.
Right.
#2 is diabetes. We call the silent killer. every fourth person in Kashmir is diabetes. Then patients with high blood pressure, and also patients with bad cholesterol level, high cholesterol, especially LDL. Patients with family history, if somebody's father, mother, brother had a heart problem, they are more likely to have the same thing. And stressful situations and not having good lifestyle, eating habits. These are the really things which a person can have and develop these blocked arteries which nourish the blood to the heart. So I think we have also learned that right from the childhood, if you give them the right food, and to make early diagnosis of blood pressure, early treatment of diabetes, early treatment of high cholesterol, if you do that, you can prevent not only a heart attack, you can prevent surgery, you can prevent angioplasty, because there is so much advance now in these early checkups, early treatment, like a car. Suppose you have a car, you get regular checkups. That is important, not to wait till something else happens. Make early checkups, early diagnosis.
No, people are using the junk food so much today in today's life.
Well, that is the number one cause then, as I said.
What precaution should we take in case of health, especially heart disease and other things like diabetic?
Well, what we have to do is, if you are diabetic, to have the right treatment at early stages. And the eating habits, exercise. If they have high blood pressure, to get early treatment. Not to wait till something happens. Same as if the cholesterol is high. We have now great drugs we call statins. They are modern medical medicines. So if you have a very high cholesterol, a bad cholesterol called LDL, you give them statins. There's a 50% reduction in heart attacks with that medicine called statins. They can even prevent new blockages if you give them early. That is the key thing, early lifestyle changes and early treatment. And people have to be aware if they have chest pain, with shortness of breath, a pain going down the left arm, they're sweating, this could be the part of the heart attack. And they have to get early treatment for that.